My name is Biju Krishnan and I'm speaking to you today from a very hot and sunny Edinburgh in Scotland. Now, apologies for the slightly delayed start. This webinar was heavily oversubscribed and there were quite a few people who came in at the last minute, so I just wanted to give everyone a chance to log on. So, wherever you are in the world, it's good to have you on board. We're going to talk today, for the next half an hour, 40 minutes or so, about Cfast. It's something that has been in the UK and the US now for a good few years, and just about to hit your shores in Australia. I was out there last month, and a lot of very excited dentists have seen the potential of this. So, the guys that are starting the cases and the courses now very much are pioneering this, and it really is a very exciting new way to look at cosmetic dentistry. So what is it? Well, it does stand for something. It stands for cosmetically focused adult straight teeth. And before I start, I want you really to think of this more as an extension of cosmetic dentistry, not orthodontics. That's really important. Orthodontics, it's a very different animal. What we're doing is really some very simple movements at the front of the mouth, really keeping it from canine to canine without trying to change the occlusion. This system was really designed for the general practitioner, and one of the main remits of doing that was to try and keep it extremely occlusion friendly. So what we're trying to do is minimum changes at the front of the mouth, changes at the front of the mouth for a cosmetic improvement without actually changing the bite. So that's really critical. Okay, and I think a more accurate way to describe this rather than orthodontics is really to look at it as cosmetically focused orthodontics. So really just changing the teeth in the front of the mouth, the teeth that most adults are concerned about when they come to see you for a cosmetic opinion. And it's a very new thing. So in the literature, there really isn't a definition that I was happy with when I first got into cosmetically focused orthodontics a few years ago. So in my opinion, this is pretty much what we are trying to do. Okay, we're trying to get a cosmetic improvement at the front of the mouth in the aesthetic zone without really changing the occlusion. And really, we're trying to complete treatment in less than 9 months. It's also a philosophy of treatment, not a modality. What I mean by that is there are many ways to move the teeth at the front of the mouth. What we're going to talk about tonight is a fixed appliance, a labial fixed appliance. However, you can do it lingually. You can use a clear aligner system, and you can even use removable spring aligners. This is somebody wearing a labial fixed appliance. You can see it's very aesthetic. But we can also achieve the same results with removable aligners. You can also have a fixed lingual system. So there are many ways to do this. So let's get straight into it. What can it do? I want you to ask yourself a couple of questions when you see these cases. Firstly, how would you treat this purely restoratively? And secondly, how long would this take with conventional orthodontics? Now, every case that I'm showing you here, I think every patient had been for a conventional orthodontic opinion, and for one reason or another had decided that wasn't for them. Okay. So let's have a look. So the very basic thing is just to really correct simple to moderate crowding. So this is a bread and butter case. 60 to 70% of cases that you will see are like this. And you'll have many, many patients who present with this degree of crowding in your existing patient base. What would you do here? What are the options here? Well, this patient came to see me for a second opinion. She's early 20s. She had been to an orthodontist, and the orthodontist just suggested she wear a fixed appliance for about 15 to 18 months to correct the crowding. She'd also been to see a restorative dentist who had given her the option of 8 veneers. So beyond those things, there's really not much else you can do to correct that. However, with short-term orthodontics, this is the kind of result we can achieve. That was done in around about 8 weeks. Okay, so quite powerful. Here's another case. a bit more extreme. This lady was due to be married in 10 months. She had also come to see me. Actually, it was her third opinion she came to see me for. Again, she'd been to an orthodontist. A fixed appliance obviously wasn't going to be suitable for her given the time frame of the wedding. Somebody, I don't know who, but somebody always will, had said that they would do some veneers and crowns, which I'm sure you agree would be hugely destructive. But again, what we decided to do was try and get a significant improvement with some short-term orthodontics. So we didn't remove any teeth, and this is the result we got in about 6 months. Now, you can do pretty much all of these cases once you've been on the course. This looks relatively complex, but actually it's a very simple system to do. Okay, so I'm sure you'll agree that's a pretty good result in that period of time. Still a little bit of crowding. You can see it's not absolutely perfect. And what we do say to these patients is we're trying to get a significant result, a significant improvement, not necessarily a perfect one. Okay, rounding up the arches, well, you can see in this case here, again, this young gentleman, I think he's about 28, was told he would need a couple of premolars removed and an appliance for around about 18 months to 24 months. Again, that really wasn't an option for him, so we didn't do any extractions. We went from here to here in about 6 months. Okay, so again, this is the same case from the front. So again, quite a bit of crowding. Went from there to there in about 6 months. So it's not perfect. Okay, what we're trying to do is get a significant improvement, and for him this was ideal. I'm sure you'll agree there's certain other things that we can do here. We can do some whitening, we can do some composite bonding, but for this gentleman actually he was just more than happy to have straight teeth, so we left it at that. And 6 months of treatment. Spacing cases are great to treat. Again, young patient here. We managed to do that in about 5 months. So it really is very life-changing for these patients. You know, if they're not going to have fixed orthodontic treatment or conventional orthodontics, if they're not going to have restorative treatment, they really have only one other option. And more often than not, that option isn't to do nothing. That option is, I just won't smile for the rest of my life. And quite sadly, that's the decision they make, whether it's consciously or unconsciously. A lot of these patients, they don't know how to smile. They cover their smile, they hate having their photographs taken. So for these patients, it's not just changing their smiles, it is quite literally changing their lives. And you're doing it with some very simple procedures. This is another case here. You can see here that the lower arch, the gingival health is not ideal. So again, just helping to alleviate that crowding. We treated here upper and lower, and that's the result we got. You can still see here there's still a bit of tartar around here, but I think you'll agree the overall gingival health has improved considerably. And again, we just did a bit of whitening and composite bonding, which you quite often have to do with cases just to finish it off. And again, it's not perfect, but this is what we call a significant improvement. And for patients, for many patients, this is ideal. Rotations. How would you treat this without devitalizing at least 2 teeth? Or without conventional orthodontics? Again, the young gentleman didn't want to have conventional orthodontics, but that's the result we got. Without hacking the teeth to bits, in fact, very little removal of enamel in about 6 months. Okay, so quite powerful stuff. Looks complex, but actually very, very quickly we can show you how to do this. This is the hardest thing for most cosmetic dentists. We're pretty good at managing the white stuff, the enamel. It's really hard for us to get the pink aesthetics right. Okay, so if you've got a case like this, now, looks complex. Restoratively, how would you treat this? Well, if this patient had come to see me maybe 4 or 5 years ago, the only real option other than orthodontics would be to raise a flap, take away the crestal bone, reposition the crestal bone apically, re-establish biologic width, replacing the flap apically, do some heavy prep crowns or veneers, and hopefully everything stays where it should be. Quite challenging, not very pleasant for the patient, difficult to gauge how stable that would be. With a short-term orthodontic approach, this is probably one of the simplest cases we can do. If we fitted the appliance, left this patient to pretty much do nothing, she would pretty much come back looking like that. Okay, the big advantage we have with short-term orthodontics is as the teeth move, the gum and the soft tissue moves with it. So that's our aim with short-term orthodontics. We don't look to align incisal edges. What we try and do is we align gingival margins. If we can achieve gingival symmetry, it's very easy for us as general practitioners to sort the white stuff out and to get the edges even. And we'll talk a little bit about that later. Okay, so the same case again. Look at those lowers. Look at that, how high those incisors are. And that's the same case. Okay, relatively simple to do. I think we completed that in about 7 months. Again, very common. You get this one tooth that's flared or locked out of the arch. Very powerful to be able to treat this simplistically. Is there room for that canine to go in without doing any extractions? I think when I first looked at this case, I probably said, no, that's not possible, but it is. So again, this is maybe one of the more complex cases, which we probably would need a bit more experience to treat, but you can it's just to give you an idea of what can be achieved with short-term orthodontics. It's very powerful. Okay, and again, in this young lady's life who's just about to go into university, that's life-changing. Okay, we do a lot of this work. This lady had come to me. She was she'd been quoted to have all these crowns replaced, just replaced. But again, just replacing those crowns is very difficult. There's problems with gingival symmetry there. You can see the angulation of the upper right lateral. Just replacing those crowns, you'd have to have compromises in symmetry and in proportion. So it's great to be able to pull these teeth together prior to doing any work. And again, the big advantage with this is we can actually bond to porcelain. So you can see there, bonding brackets to porcelain, managed to pull those teeth together. It's still challenging, but I'm sure you'll agree that's a lot easier now to replace those crowns. You'll get a much better predictable end result. Crossbites. This is quite challenging again. It looks challenging, actually it's relatively straightforward. Okay, you look at this case here. Now this patient again has been to see an orthodontist. What's this patient's problem? Well, you're all thinking posterior crossbite, you're thinking anterior crossbite, you're thinking issues with canines. What this patient told me was her biggest problem was she hasn't had a boyfriend in 7 years. That's real life dentistry. She's not particularly cared about her crossbite. What she's concerned about is her smile. Okay, she wants to just have the self-confidence to go out and have a bit of a life. Now, restoratively, that's quite challenging restoratively. Look at the gingival margins, look at where those canines laterals are. It's doable, but she shied away from that, okay, for obvious reasons. She hasn't really wanted conventional orthodontics. Conventional orthodontics in her case would have taken about 2 to 2.5 years. She really didn't want any more attention drawn to her teeth than she already has, so that wasn't an option. So again, this with short-term orthodontic approach, again, is extremely simple. You just place the brackets, they pretty much do the job themselves, and in a few months that's the kind of result we got. Okay, the laterals came over the bites. Small black triangle here, which will probably close up in the next month or two. This was taken immediately post-operatively. So you can see that those laterals came over the bites. She still has the cross bite posteriorly, so while she's now in the process of getting a life, she can contemplate on whether she needs that cross bite fixed or not. Okay. I'm sure you'll agree that's quite a dramatic result. We just did a bit of composite bonding on the laterals. That's life-changing. You can see the difference in her smile. It's all in the eyes. Okay, so this is so true. We don't just change smiles, we change lives. This is a very powerful tool to add to your practice. Okay, so why don't most adults want conventional orthodontics? Well, we know the answer. It just takes too long. You know, most adults are 18 to 24 months. That's still the perception of a fixed appliance, and at entry level, that's pretty much what they're going to get still. And it's expensive. There's no way around it. So if not conventional orthodontics, then what? So if they're not going to have a brace, crowns and veneers, yep, that's an option. It does involve quite significant tooth reduction, and modern day dentistry, we're trying to get away from that. It's difficult and stressful, not just for the dentist, but also for the patient. It can be lucrative, but there's less people out there now, certainly here in the UK, willing to spend that kind of money. So quite often we're resigned to do nothing. Okay, there's really nothing else. The patient has just resigned themselves to that's what they have. The dentist has really nothing else to offer, which is not so good. Okay, so why don't most of us offer any orthodontic treatment. I think it's a little bit of this. I think it's a little bit daunting and we're a little bit scared, and from most of our university days, that's the kind of thing I think we are just more than happy to forget. I don't know how it is in Australia, but certainly here in the UK, I think we're taught consciously to fear fixed orthodontics more than we fear death. That's probably not an exaggeration either. I remember for the first, as soon as I graduated, I remember the ceremonial burning of the orthodontics books and thinking, thank God I never have to do this again. But in reality, if we are doing conventional orthodontics and we are changing the occlusion, then there's no way around it. We need to understand this, and not just understand it, but be able to apply this to practice. So there's ways around it. We need to keep it simple, keep the occlusion safe, and just deal with what we're comfortable with as general practitioners, and that's anterior occlusion. Okay, so Cfast. Well, it is fast. Most treatments are done in about 4 to 6 months. It is very simple. It's a very practical thing. You can have fixed or removable options. It's tooth friendly. It's low cost to the patient, and it's another income stream for the practice. So how does it work? Well, there's a couple of components. There's wires. These wires are nickel titanium, so they have a memory built into them. So no more wire bending. As the wire is distorted, it tries to regain its arch form. The wires go into the brackets, and we've got a little animation here that shows you exactly how it's going to work. So when the wire is first placed and first fits into the brackets, it's distorted. As it regains its shape, it just takes the teeth with it, as you can see. Just regaining the shape there and just taking the teeth with it. Okay, so the big advantage here is it's all done for you. Okay, that bracket positioning is set up by the lab. The wires has that memory built into it. You just need to make sure that you're doing a few simple procedures to help the arch line out. So how do we do it? Well, we need to take some x-rays. We need to have a series of photographs. This is the kind of impression I take before I send work off to the lab, so just like a putty and a light-bodied wash. You can do that as a one-stage impression. Send everything off to the lab, and that's what you get back. So from the laboratory, you get everything back that you need really to finish the case. You get the brackets that are set up for you. You get some lip and cheek retractors. You get some wires, some flowable composite, and some bond, and instructions on exactly what to do. This was the big lights on moment for me when I saw this, because up until this point, I was thinking, yes, it is fixed orthodontics, and I still will have to place brackets. Well, this takes the guesswork out of that. All the brackets are really positioned for you in this little carrier by a skilled technician who knows exactly where to place them. Okay, so what we're going to do is we're just going to polish the teeth, apply a little bit of etch in the center, dry, and we're going to fit the appliance a quadrant at a time. Okay, so we're going to do a little bit of bond onto the tooth, a little bit of flowable composite onto the brackets, seat the tray, do a little bit of light curing all the way around, and then it's just a simple case of peeling the tray away. Okay, there are two parts to this tray. There's a hard outer part and there's a thin inner part. As you peel it away, the brackets remain in place. And if you're doing the lower arch, again, just repeat the same process: etch, bond, light cure, and peel the tray off to leave the brackets in situ. And that's us. Quite simple. It really is as simple as that. These little dots, they can be easily scraped away. They just help to position the brackets. We then need to place some wire. So we place the wire on the teeth like this. This wire is held in place by these things called O-rings. So we'll show you, when you come on the course, we'll show you plenty of hands-on time just to be able to get used to placing these O-rings and placing the wires. And that's it. It's as simple as that. That procedure should take no more than half an hour to 45 minutes. Okay, so just very quickly, and I'm skimming over this, but of course when you come on the courses, we'll cover this all in great detail. And any questions that you have, please just send me an email. I'll give you the email at the end, and we can answer those as best we can. So we're treating crowded cases, so we need to create a little bit of space to allow the teeth just to unwind. So we're going to talk a little bit about IPR. IPR, really, it stands for interproximal reduction, and it really is to create a small amount of space. Now, it really is small. It's not hacking great chunks of teeth away or chunks of enamel. We're talking that kind of reduction. Okay, it's very small and it's very controlled. And quite often you don't even see a gap. How much space can we get with IPR? Well, we can see here that really between the mesial of the first premolar to the opposite first premolar, we can gain about 4 millimeters of space. However, it's very unlikely in most of our cases that we'll need anything like that. What happens with a fixed appliance is the arch rounds out. As the arch rounds out, you gain a tremendous amount of space. This is the tools that we use for IPR. You can see it's these are diamond impregnated polishing strips. So we know exactly how much enamel we're removing per surface. And you can see that that's a lot more conservative than even a veneer prep. Okay, so that's how it's used. These are flexible, so even though we're doing IPR, we're still trying to maintain the original tooth morphology. So this is the rounding out effect. This is where we gain a lot of that room. Okay, as the arch rounds out, you gain a lot of space. Now it goes back to our old geometry, if you can remember. The relationship of a circle to its diameter is 1 to 3 or 1 to pi. So therefore, if you're increasing the overjet by about, say, 1 millimeter, you actually gain 3 millimeters in the circumference. Okay, so that small movement anteriorly is going to give us quite a large space mesiodistally. All right, so that's a very, very powerful movement. That is also the trade-off with short-term orthodontics. You do get a slight increase in the overjet. So you need to make sure that if the case is suitable, that you are checking the overjet. What will the overjet look like at the end? Are we going to lose guidance? Do we have to do something? Or is the case just not suitable? Not every case is suitable. Okay, and one of the systems we have put in place is a very good triage system and excellent support to help you identify your first cases and check for suitability. Okay, so the opposite of that, if you've got crowding, the opposite of that spacing. So again, we can close spaces very effectively. You can see this gentleman here, quite extensive spacing. So again, it's great to be able to just close those gaps. This is what we use to deal with spacing. It's something called power chain. It's basically just a big elastic. And that's a that's a great result, simple result. Again, space cases are great to start with. Okay, you can see the results there. You do get sometimes the bunching of the soft tissue there, which usually within a month or two remodels itself. So let's go through a case by case. This is roughly how things work out on a month-by-month basis. This is Natasha. Natasha is getting married in about 8 months and not happy with her smile. So that's what it looked like on day one. So we fitted the appliance and sent her on her way and got her back in 4 weeks' time. So 4 weeks' time. Well, that's what it looked like when it was fitted. This is what it looks like now. So not much of a change. Then what we did was we do a little bit of IPR on both sides, and then send Natasha away again. Okay, and then get her back in another 4 weeks' time. Replace the wires, replace the O-rings. Okay, so when she first came in, this is what she looked like. Month 2, her third visit, 2 months into treatment, you can see we're starting to uncross those centrals. Okay, the spacing from the IPR from the last visit's closed up. Okay, we're going to do a little more IPR again, keeping it quite conservative. Send Natasha away again and get her back in another 4 weeks. Okay, so this is where we started from. So now we're 3 months into treatment. Natasha's 4th visit, and that's what it looks like now. So you can see here that's where we were previously. So you can see the spacing is closed. The centrals have pretty much aligned themselves quite nicely. So that's where we started from, and this is where we are now. So at this stage, Natasha says, I really like this result. Can we please take the braces off? Now, normally at that stage, you would just say yes and leave it at that. However, we had a small discussion with Natasha, and although her incisal edges are level, the gingival margins aren't quite level yet. Now this is one of the huge advantages of a fixed appliance and doing it yourself. You have so much more control over these final movements. Any one of you who does any degree of clear aligners, there's a few of them out there, you'll know that fine tuning at the end is very difficult, and there's not much you can do in cases like this other than taking some more impressions, sending it back off to the lab. It's expensive, it's time consuming. But in this case here, we thought we'd try and align these gingival margins. Natasha was very much aware that she was going to have some incisal edge composite bonding anyway, as these edges aren't straight. So here's a little trick that you can do. You can just use the wire and you can just wrap it around the lower end of the bracket like this. And this is quick. We got Natasha back in 3 days, and in 3 days that's what's happened. Gingival margins are now symmetrical and even. Incisal edges are not. But again, using our general practice hats and our cosmetic dentistry skills, we can tidy that up. Okay? So that's the result we got with a bit of composite bonding. All right. So that's quite easy dentistry. And we are much more in control of what's happening. All right. So that's a pretty good result in about 4 months. 3 months of appliance treatment followed by whitening and then composite bonding. All right. I'm sure you agree that's pretty good, very conservative, very easy dentistry. Okay, now all these cases, as with any appliance, any orthodontic treatment, fixed and removable retainers are available. Any type of orthodontics, whether it's conventional or short-term orthodontics, will relapse. Regardless of what the orthodontist says, if teeth aren't retained permanently, they will move. We know this because about 70% of patients that come to see me have had orthodontic treatment in the past. Okay, I'm not saying every case will relapse, but a significant number will. So long-term retention is critical, and that's regardless of whether it's conventional orthodontics or short-term cosmetic orthodontics like this. So we recommend 2 types of retainer. A fixed retainer, which is just bonded to the inside, the palatal surface, and we also recommend a removable retainer. Now the way to look at this is the removable retainer is the main retainer, and I ask patients to wear this at night over their fixed one. Okay, and it comes for you like this, so again it's in a carrier, just to allow you to seat it easily, and again positioning is all done by the laboratory for you to make life as simple as possible. And again, that's the removable retainer. So remember, that's the main retainer. I look at the fixed retainer as the backup. So should anything happen to the removable retainer, the teeth are not likely to move until they get a new one. Okay, so in summary, just to wind things up, cosmetic dentistry is changing significantly. Okay, there's much more of a trend towards conservative and less invasive approaches. So you now are aware of how quickly teeth can be moved, how simply they can be moved. So now you're in a great position to be able to offer that to patients. Very, very much are gone the days when we need to remove lots of enamel. Okay, so this is the day, this is the kind of thing that we're teaching. We're going to align the teeth, so that's very much where our short-term ortho comes in. Very often we're going to whiten the teeth, and then we're going to do a little bit of composite or ceramic bonding, usually again minimal or no prep, just to finish things off. So this is where it differs very much so from conventional orthodontics. Okay, we're not just about moving teeth, we're about creating a nice smile. And we have so many more skills in our tool bag to be able to do that. So composites, you've got to be good at composites, and that's one thing I strongly recommend. If you're average at composites, like I am, then have a really good composite to use. I use Venus Diamond, and a lot of these cases that you've seen have finished off with Venus Diamond. It's a very forgiving, but again, you use what you feel comfortable with. Again, you don't really need to do a lot of layering techniques. None of the cases I've shown you have been layered. They're really just single-bodied composites. There are some very, very good materials out there, very forgiving, and can finish cases off very beautifully. So let's look at some. This is John. John had come to see me. Why would John come to see me? John is 65. You'd think 65, he's lived with his teeth all his life. Why on earth would he want something done now? Well, John is a grandfather, and John's grandson one day coming out of nursery said, "Grandad, you remind me of a vampire," which is all very funny initially, but then it gets to John, and John thinks, maybe I need to do something about these teeth. Okay, so where do you start with this? Orthodontically, what do you do here? The gum margins are all over the place, the incisal edges, there's a lot of wear, lots of rotations. But again, we keep it simple. The appliance is designed to align gingivals, to get gingival symmetry. So that's what we did, and that happens really quite simply. But you can see just getting gingival symmetry is not enough. We need to bring other tools to the table. So again, all we did here was a little bit of composite bonding and some whitening, and that's the result. Okay, so from there to there is quite simple dentistry. I would also urge you to maybe just accept that from there to there is also very simple dentistry. Okay, but this is also very good dentistry. Little to no drilling of any enamel here. All right, and for John, that's pretty much life-changing. Okay, new glasses, new hairstyle, and no longer a vampire to his grandson. Okay, and all in 6 months. Okay, here's another case. We get a lot of these cases where, I'm sure you will as well, where patients just want to look good on their wedding. And this is Ria. Ria wanted just a smile. She left it a little bit too late. She wanted it in 5 months. She's getting married in 5 months. So again, she'd come to see me. So again, with the ABC approach, you can see here what we're going to do is, again, just align the gingival margins. It's always going to be a bit of a compromise here. And again, we're just going to manage her expectations. That's the result we got after the alignment phase. So again, not perfect. You can see this canine still a bit high. Ideally, we'd have liked it to come down a little bit more, but she's getting married in about 2 weeks' time, so we had to just end the treatment there. But again, a bit of whitening, a bit of composite bonding, and that's the result we got. Okay, so again, that's quite easy. Once you get the teeth aligned, really to get from there to there is relatively simple. All right, so this is what we're trying to do. We're trying to take the difficulty out of cosmetic dentistry and also make things much more conservative and much more in the realms of general practice. All right, here's another great case. This lady was very much in the media business, behind the camera, but looking to get in front of it. So you can see here that difficult one. Where do you start with that? Well, she'd been for an orthodontic opinion. Orthodontics was going to take too long, and she's going to miss her window of opportunity for the new job that's coming up. Restoratively, I wouldn't like to treat this restoratively. It's extremely challenging, even for the best dentists out there. Okay, but again, with short-term orthodontics, just focusing on those front 6 teeth, this is actually an extremely simple case. You're just going to place the appliance that's made for you, and in about 4 months, you're going to get that. And I'm sure you'll agree, from there, you know exactly what to do. This, again, it's just a case of simple composite, incisal edge composite bonding, and that's the result there. So to go from there to there in about 6 months with that much difficulty, it's extremely powerful too. And not only did she end up in front of the camera, she actually ended up with a contract to do some toothpaste commercials. So that was quite a powerful testimonial for us. Okay, so the whole thing is managing expectations. What's the end result going to look like? Where are those teeth going to end up? It's good to be able to know that before we start. This is one of the new bits of technology that we've introduced, some 3D imaging. Some of you may know this gentleman. This is Amarjit Gill. Amarjit was the former president of the British Dental Association, and for most of his life, while occupying that role, walked around representing Britain with those teeth. So pretty much secured our place in history as having one of the worst teeth in the world. Okay, so Amarjit, as we said to Amarjit, this cannot happen. We've got to uphold some degree of cosmetic standards in the British industry. So we sat down and we convinced him to have a little bit of short-term ortho. I think up until now, Amarjit really didn't want orthodontics because, again, it involved extraction, lots of long-term appliance treatment. But what made a difference for him was just showing him what the end result could look like. Okay, just managing the expectations. So we can see here, this is a 3D imaging that you can have. This is just snapshots, but this is what you can get back from the laboratory, and the laboratory can show you in a 3D, and you can show this to your patients what the end result is going to look like. So you yourself can see where the incisal edges are going to end up, what the overjet is going to look like. You can get these printed out as well. So You can get actual models that the patient can take home, and you can treatment plan in that way. Okay, so it's a very powerful tool to help you manage your cases. And that's Amarjit. This is Amarjit 2 weeks ago, in fact, 3 months to the day of having the appliance fitted. So 3 months and pretty much straight teeth. Okay, a little bit more work to be done here, but you can tell he's delighted. So it all impinges around support. The reason it's worked so well in America and so well here in the UK is that there's no getting around the fact that fixed orthodontics is scary, it's daunting. We're told by all our orthodontic colleagues how difficult it is and how we shouldn't be doing it. And for the most part, I agree with them, but if we're keeping things simple, if we're keeping things occlusion safe, then it's very much within realms that we can treat. You need a lot of support. The course is designed to get you confident to start. I don't think for 1 second that you will know everything after the course, but you will have the basics to start. Once you start, you need to be reassured that there is a tremendous support network in place. And that's one of the reasons that it's taken us a while to get to Australia, because it's all very well coming there and introducing the system, but without the support on the ground, it's very difficult for you to continue to feel confident to continue your cases. Okay, so there's various ways to do that. We have a forum. It's an online forum where you can post all your cases, and we can assess them all to see if it's suitable. We also have extremely good laboratory support, and we have a very good team of guys now on the road, which will be able to give you one-on-one support for all your cases, for anything regarding clinical issues, commercial issues, whatever you need. So let's look at the numbers. Well, we reckon in Australia we're looking to charge for a single arch about $4,000. Your costs for the bracket setup about $590, and for 2 retainers, both fixed and removal, about $150, which leaves you quite a decent profit, over $3,000. Doesn't take very long, 4 to 5 hours, which if you compare that with clear aligner treatment, is significantly shorter. So it's a pretty good hourly rate for something that's relatively simple dentistry. If you're doing both arches, it's about $6,000. Charging about $6,000. Again, this will vary depending on where you are. Your lab costs aren't double, so therefore your profit is more, but your hourly, and funnily enough, actually doing 2 arches doesn't take significantly more time, so your hourly rate goes up quite significantly. The big and here, though, is that a significant number of your patients, 70% or more, will need some degree of post-operative whitening or composite bonding. Okay, so we got our courses starting from next month and then going on throughout the year and next. These courses are pretty much almost full. I think you need to speak to the guys on the ground. We'll give you the contact details. It's $990 for the course, and that includes your starter kits as well. Okay, and if you're part of this course, then if you've seen this webinar, then you can get 50% off your first case. So I would act on that quickly. So that's me. I'll just wrap up now. Thank you for your time. This was a heavily subscribed webinar. If your friends or your colleagues haven't been able to get on, I think about 100 of you did, then apologies. If you can pass their apologies on to me, we'll try and get this recorded and sent out to you. Any questions that you have, please speak to the guys on the ground. That's the telephone number, and that's the website and the email address. I know quite a few of you have cases already in mind. What you can do is take pictures, and if you can email at info@cfast.com.au, mark it for my attention, and we can tell you if they're suitable or not. So look forward to seeing you on the courses. The courses will be quite small. We're not looking for very big courses because we want everyone to be able to have good one-on-one time with myself and the other instructors, and we want you to be able to leave confident to be able to start your first cases. So the courses are restricted in numbers, so I would try and get on there as quickly as you can. Okay, it's a pleasure speaking with you. Have a good evening, and hopefully we'll meet soon. Good night.